121. When interviewing patients who are distraught or potentially violent, you should do all of the following except A. Remove the patient from the crisis situation as quickly as possible. B. Encourage the patient to explain the situation in his or her own words. C. Firmly tell the patient whenever he or she is distorting reality. D. Avoid arguing with or shouting at the person who is distraught. Answer. C. Firmly tell the patient whenever he or she is distorting reality. Explanation. The goal is to calm the patient and gather information, not to confront or correct their perception forcefully. This can escalate the situation. 122. What term best describes a patient who talks nonstop and is restless and overactive? A. Manic. B. Depressed. C. Demented. D. Schizophrenic. Answer. A. Manic. Explanation. Manic episodes are characterized by excessive energy, restlessness, and rapid, nonstop speech. 123. Lifting improperly may most likely result in an injury to which part of the back? A. Cervical. B. Thoracic. C. Lumbar. D. Sacral. Answer. C. Lumbar. Explanation. The lumbar spine is most commonly affected by improper lifting due to its role in bearing the body's weight. 124. After experiencing a sudden syncopal episode, a 41-year-old female is complaining of pleuritic chest pain and shortness of breath. Her vital signs are RR equals 28, P equals 126, and BP equals 88/60. The pulse oximeter reads 89% on high-flow oxygen. Her breath sounds are clear. Which of the following conditions best describes the patient's signs and symptoms? A. Pulmonary embolism. B. Pulmonary edema. C. Chronic bronchitis. D. Acute asthma. Answer. A. Pulmonary embolism. Explanation. The combination of sudden syncope, pleuritic chest pain, shortness of breath, and hypoxia suggests a pulmonary embolism. 125. What is the management for a patient with a head injury and an unusual respiratory pattern? A. Positioning in the left lateral recumbent position. B. Administration of oxygen and methylprednisolone. C. Rapid transport because of possible brain stem injury. D. Intubation and hyperventilation to reduce ICP. Answer. C. Rapid transport because of possible brain stem injury. Explanation. Unusual respiratory patterns can indicate brain stem injury, necessitating rapid transport. Answer questions 126 and 127 on the basis of the following information. You respond to a 56-year-old male who appears to be intoxicated. He is belligerent and disoriented and has a laceration on his forehead. You have made several attempts to convince him of the need for treatment, but he refuses treatment or transport. 126. Given this situation, you should A. Let him sign a refusal form and return to service. B. Call medical direction for advice and guidance. C. Transport the patient against his will and restraints. D. Bandage the laceration, then leave the scene. Answer. B. Call medical direction for advice and guidance. Explanation. Consulting medical direction is crucial when dealing with patients who refuse treatment but may require it. 127. Regardless of any of the options considered in the previous question, the patient continues to insist he does not need medical attention. In this situation, which of the following is most important? A. Obtain a signed refusal form and return to service as soon as possible. B. Continue to insist that the patient accompany you to the hospital for care. C. Properly document your advice to the patient and his continued refusal. D. Restrain the patient in the supine position and transport him immediately. Answer. C. Properly document your advice to the patient and his continued refusal. Explanation. Thorough documentation of the refusal and the advice given is crucial to protect against legal liability. 128. You are called to treat a patient who is unconscious and responsive to painful stimuli only. Which of the following treatment modalities is appropriate for this patient? A. 25 gm of 50% dextrose low 4 push, 2 mg naloxone 4, and transport to a detoxification center. B. Blood glucose test, dextrose, if indicated, thiamine, monitor, oxygen, 4, and rapid transport. C's oxygen, 4 fluid bolus titrated to a systolic BP of 100 to 110 millimeters of mercury, naloxone, and rapid transport. D. 1,000 cubic centimeters Ringer's lactate 4, oxygen, ECG monitoring, and transport to an emergency department. Answer. Beads blood glucose test, dextrose, if indicated, thiamine, monitor, oxygen, 4, and rapid transport. Explanation. The patient's reduced responsiveness necessitates a thorough assessment including blood glucose testing and appropriate treatment based on findings. 129. During a basketball game, an 18-year-old male is complaining of sudden shortness of breath and sharp chest pain that increases with inspiration. He is alert, warm, and diaphoretic. His vital signs are RR equals 24, P equals 100, and BP equals 122/84. His breath sounds are diminished in the lower right lung field. He denies any medical history, does not smoke, and takes no medication. Which of the following conditions best describes the patient's signs and symptoms? A. Pulmonary embolism. B. Simple pneumothorax. C. Asthma. D. COPD. Answer. B. Simple pneumothorax. Explanation. The acute onset of chest pain and shortness of breath with diminished breath sounds points to a pneumothorax. 130. A 64-year-old male complains of weakness and dizziness. He is anxious, with a patent airway with adequate breathing. The pulse is rapid and skin cool and diaphoretic. Auscultation of the lung reveals bilateral rales. His vital signs are pulse, 156, respirations, 28 per minute, blood pressure, 82/60 millimeter of mercury, and SpO 292%. His ECG is depicted in Figure 4.1. The best treatment for this patient is to A. Decrease the atrial rate. B. Restore a normal sinus rhythm. C. Decrease the ventricular rate. D. Increase cardiac contractility. Answer. A. Decrease the atrial rate. Explanation. The patient's symptoms suggest atrial fibrillation with rapid ventricular response. Controlling the atrial rate is crucial. 131. Which of the following statements regarding a spontaneous pneumothorax is true? A. It usually requires pre-hospital chest decompression. B. It is usually limited to only 20% of the lung and is well tolerated by the patient. C. It often progresses to a tension pneumothorax, if not relieved. D. It usually occurs in individuals more than 50 years of age who are otherwise healthy. Answer. B. It is usually limited to only 20% of the lung and is well tolerated by the patient. Explanation. Spontaneous pneumothoraxes are generally well tolerated and usually affect a small portion of the lung. 132. The best place to assess for cyanosis in an infant or child is the A. Oral mucosa. B. Nail beds. C. Soles of the feet. D. Area around the eyes. Answer. A. Oral mucosa. Explanation. Cyanosis is best assessed at the oral mucosa as it provides a clear indication of central oxygenation. 133. Your patient is a 4-year-old girl who awoke in the middle of the night with a cough that her mother describes as sounding like a seal barking. The patient feels more comfortable sitting up. Vital signs are respirations, 26 per minute, pulse, 100, temperature, 101 degrees Fahrenheit. On physical exam, you hear stridor on inspiration. From this scenario, you should suspect which condition? A. Airway obstruction. B. Croup. C. Epiglottitis. D. Asthma. Answer. B. Croup. Explanation. The seal-like bark and stridor are classic signs of croup. 134. What volume of fluid bolus should be given initially to a severely dehydrated child? A. 20 milliliters per kilogram. B. 30 milliliters per kilogram. C. 40 milliliters per kilogram. D. 50 milliliters per kilogram. Answer. A. 20 milliliters per kilogram. Explanation. Initial boluses for severe dehydration in children typically start at 20 milliliters per kilogram. Adjustments are made based on the child's response. Answer questions 135 to 138 on the basis of the following information. You are called to the home of a 21-year-old female in active labor. She is 2 weeks from her expected due date and is having contractions of 1.5 minutes duration, which are 3 minutes apart. This is her second pregnancy. Her first child was delivered vaginally at full term. 135. What is your first course of action for this patient? A. Place her on the stretcher in high Fowler's or comfortable position and examine her for crowning. B. Place her in the left lateral recumbent position, apply oxygen, and transport her immediately. C. Call her obstetrician and advise him or her that the birth is imminent. D. Place her in position of comfort with a sanitary napkin over her vagina and transport rapidly. Answer. 8. Place her on the stretcher in high Fowler's or comfortable position and examine her for crowning. Explanation. The priority is to assess for crowning to determine if delivery assistance is required. 136. Your patient suddenly tells you she feels something slippery between her legs. Upon visual examination, you notice a 2-inch segment of the umbilical cord protruding from the vagina. What is this condition called? A. Prolapsed cord. B. Abruptio umbilicus. C. Placenta previa. D. Abruptio previa. Answer. A. Prolapsed cord. Explanation. The condition described is a prolapsed cord, which requires immediate action to relieve pressure on the cord. 137. Which of the following is not an appropriate treatment option for this patient? A. Provide high-flow oxygen and rapidly transport the mother in the knee-chest position. B. Take pressure off the cord by placing your fingers into the vagina and gently lifting the infant. C. Wrap the cord in a moist sterile dressing, provide supplemental oxygen, and transport quickly. D. Place the mother in the right lateral recumbent position and transport immediately. Answer. D. Place the mother in the right lateral recumbent position and transport immediately. Explanation. The right lateral recumbent position is not ideal for managing a prolapsed cord. The knee-chest or Trendelenburg position is preferred. 138. You are ready to transport this patient. If the umbilical cord is still exposed, how can you use it to evaluate the infant's perfusion? A. Gently feel the cord for pulsations to determine the infant's heart rate. B. Determine the infant's temperature by feeling the cord for changes. C. Look at the umbilical cord for color changes, with blue indicating hypoxia. D. Attach a pulse oximetry lead to the cord and determine the oxygen saturation. Answer. A. Gently feel the cord for pulsations to determine the infant's heart rate. Explanation. Feeling the cord for pulsations helps assess the infant's perfusion and heart rate. 139. You arrive at the scene of an imminent delivery in the field. The first responder, who called for assistance, reports that the patient is a 32-year-old female who is G4, P3. What does this mean? A. The patient is pregnant for the 7th time and has 3 living children. B. The patient's cervix has dilated a total of 4 centimeters in 3 hours. C. The patient has been pregnant 4 times and delivered 3 live children. D. The patient has had 4 rounds of contractions timed 3 minutes apart. Answer. C. The patient has been pregnant 4 times and delivered 3 live children. Explanation. G4, P3 refers to a woman who has been pregnant 4 times, gravida, and has delivered 3 live children, para. 140. Your patient is a 28-year-old female who reports that she is 9 weeks pregnant. She is complaining of severe abdominal pain, shoulder pain, and vaginal bleeding. Vital signs are within normal limits, and a physical exam reveals tenderness in the lower left quadrant. What should you suspect is occurring? A. Uterine rupture. B. Ectopic pregnancy. C. Spontaneous abortion. D. Abruptio placentae. Answer. B. Ectopic pregnancy. Explanation. Severe abdominal pain, shoulder pain, and vaginal bleeding in early pregnancy suggest an ectopic pregnancy.